John Ransom. I have been at Baptist for 38 years. I started June the 14th in 1981. I remember the date specifically. And I did medical school, went to medical school here in Little Rock, did my general surgery training in Little Rock and my cardiovascular training in Little Rock. And went into practice here and did general cardiovascular surgery for 25 years. And then in 2006, I started working for Baptist as part of their heart transplant, and since then we developed our artificial heart and mechanical circulatory support, or LVAD program, and I've been the director of those programs since then. I went into practice with Dr. John Weiss. He was the cardiovascular surgeon here at the time, and along with C.D. Williams. Those basically were the only two cardiovascular surgeons here at Baptist at the time. So within that short time period, several came after that, but I guess I was probably the third that was here at the time when I went into practice. When I went into practice, 95% of what we did was, or 90% was coronary artery bypasses, and then a little bit of valve surgery and a few other really odd things. But then we've just added over the years, all the other things, the defibrillators that I talked about, the ICDs, the transplants, the artificial heart surgery that we do, the artificial devices that we do, and that's pretty much the transplants and the artificial devices is all I do now. So, at that point in time when I went into practice, that wasn't, it wasn't available. It didn't happen, Transplants really started coming back and being done in the early 80s, around 80, 81, or 82. So, all that's new, and there's a lot of different, the valve surgery now, the TAVRs, the percutaneous valves that are put in. It's an everyday affair, and that's changed a lot. The valves that were really high risk for older patients and complicated patients can be done routinely now. Stenting, I remember when we did the first PTCA here, first angioplasty, the first stent here. The early years, when somebody did an angioplasty or stent, the surgeon then have to have an operating room available, and I'd sit in the cath lab and watch them for 4 to 6 hours while I got it done before I could start my cases. Now they do them on 30 minutes and they're done, and that's it. It's just so much difference in the way things are done. The LVADs that we put in now, the first one I put in was about so big, it was about that thick, and you had to have a pretty good sized person to get it into. Now the ones that we put in, I can hold in the palm of my hand like that. They still have to have a drive line that comes out, connects them to a power source, but the batteries last, 14 hours, so that's not that big a deal. But I think in the next 5 years, the devices will be totally implantable without a drive line. We'll have a percutaneous power source, so the patients can swim and shower and do all the other things that people want to do with those. And eventually, I think in the next 10 or 15 years, they'll be small enough. And I think eventually it'll be like putting a defibrillator in. I think it'll be that. It'll come down to that. The technology has totally exploded over the last few years. And now with the HeartMate 3 we use, the outcomes are almost the same as with transplant. I think to everybody that's been here, it's just a good job from developing it to the hospital that it was when I came, which was very good, to the system that it is now and to the way it serves people. I think that, we provide a really good service and take care of a lot of sick people. And I think the state's really benefited from what this hospital does.